Natural way of preventing pregnancy, natural family planning. Natural family planning, NFP, is the most commonly used birth control method, and it is also known as fertility awareness, FA, methods. These methods require long periods of sexual abstinence. They provide low and varying levels of efficacy and do not provide any protection against sexually transmitted infections, STIs. WHO, World Health Organization, defined natural family planning as voluntary avoidance of intercourse by a couple during the fertile phase of the menstrual cycle, also known as ovulation period, in order to avoid a pregnancy. Natural family planning methods are associated with higher failure rates than other available methods of contraception and often perceived as being better for women's health than hormonal and intrauterine, artificial contraceptives methods because clients have experienced the side effects of artificial methods or because they have medical conditions which limit their contraceptive choice. Fertility awareness methods rely on the fact that there are only certain days during the menstrual cycle when conception can occur following ovulation. The ovum is viable within the reproductive tract for a maximum of 24 to 48 hours, occasionally up to 72 hours. However, the lifespan of the sperm is considerably longer in the region of 3 to 7 days. Though, all these lifespans for both viable ovum and sperm can be a few hours to days longer depending on our nutritional status and how healthy an individual is. There are various fertility awareness, natural family planning methods, and their usage requires that you know them very well. You must have studied them over 5 cycles, months. That is, you must know your own menstrual cycles. As I used to say, it is not the same as others. In fact, majority of the apps designed for tracking of this is based on a regular menstrual cycle of 28 days. Classification of natural family planning methods. 1. Cycle or rhythm method. Cycle length is recorded for a minimum of 6 cycles. Likely fertile days are then calculated, allowing for the survival time of sperm and ova, using the following formula. First fertile day equals shortest cycle minus 20. Last fertile day equals longest cycle minus 10. This method requires a significant period of sexual abstinence. For example, in the case of a regular 28-day cycle, 10 days of sexual abstinence are required during each cycle. 2. Temperature method. Following ovulation, there is a rise in the progesterone levels which produces a rise in the basal body temperature of 0.2 to 0.4 degrees Celsius, which is maintained until the onset of menstruation. The fertile phase ends after 3 consecutive high temperatures are recorded. Intercourse is avoided from the onset of menstruation until the day on which the 3rd higher level temperature has been recorded. Intercourse is then allowed until the onset of the next menstruation. In the example of a 28-day cycle, abstinence is required for about 18 days per cycle. Infection, illness and medication can affect the body temperature and interfere with the method. 3. Cervical mucus method, also known as Billings method. During the follicular phase of the cycle, the cervical mucus appears like raw egg white, i.e. it is clear, slippery and stretchy, Spinbarkite phenomenon. The final day of the fertile mucus is considered to be the day when ovulation is most likely to occur. Abstinence must be maintained from the day when fertile mucus is first identified until 3 days after the peak day. The end of the fertile period is characterized by the appearance of infertile mucus, which is scanty and viscous. Semen, sexual excitement, spermicides, lubricants, bleeding and vaginal infections can confuse mucus assessment. 4. Cervical palpation method. Daily self-palpation of the cervix helps to detect the changes occurring in the size of the external os and its position relative to the introitus. The cervix rises during the follicular phase of the cycle. At ovulation, it reaches peak height from the introitus with maximum softness and the os admits a fingertip. The cervix then descends, becomes closed and firm, and is closer to the vulva towards the end of the luteal phase. 5. Lactational amenorrhea method. A natural method seen in a fully breastfeeding mother and is amenorrheic during the first 6 months after childbirth and has a 2% chance of getting pregnant. The lactational amenorrhea method, LAM, is categorized as one of the natural family planning methods. Minor clinical indicators of fertility. Ovulation pain, Mittelschmerz. Mid-cycle show of blood, onset of breast symptoms, skin and mood changes can occur in some women. When present, they can be helpful in confirming the major signs. In conclusion, the combinations of these fertility awareness methods can be used to increase the accuracy of identification of the fertile and infertile periods. However, full concentration and study of these methods can help new couples to achieve pregnancy at an early stage of their marriage provided nil tubal blockage and infections.